Jenike, who is the chair of the Scientific Advisory Board and member of the Board of Directors of the International OCD Foundation. He is a Harvard Medical School professor of psychiatry and a leader in the field of OCD. Dr. Jenike is the founder and medical director of the OCD Institute at McLean Hospital in Belmont, and also the Mass General Hospital OCD Clinic and Research Program in Boston. So please welcome.
I wrote all that for him because he was a little confused about what I'm doing.
It's just wicked smart.
Yeah, since I'm so smart and a Harvard professor, I have a 2-hour speech, so you might as well just sit down and relax. But then I thought that you've been walking a long while, you probably need some rest, don't you? So just sit down and go to sleep. Sometimes events happen that are just extraordinary and give us all renewed faith in the potential greatness of the human spirit. Today is such an event, and you and your wife and daughter are creating something that we'll all be able to hang on to and help other people forever. Nathaniel, a handsome, lovable, charismatic, and intelligent young man, took his life last year, and his parents and sister, despite their grief, are making huge strides to publicize this disorder and to help other sufferers and their families. They have turned unbelievable tragedy into a quest to help others and to honor Nathaniel's life, character, and struggles. Nathaniel suffered from body dysmorphic disorder, or BDD, as we all know now that it's called. People with BDD have a distorted body image, believing that they are ugly or deformed. They avoid mirrors, feel terrible shame, keep to themselves, and may seek unnecessary cosmetic surgery. They become obsessed with slight or even imagined imperfections, and they may withdraw from society completely. At least 20% attempt suicide. That's an astounding figure at some time during illness, and I consider BDD one of the most dangerous illnesses known to man. What are the common signs and symptoms of BDD? There's a fixation in thoughts about appearance. Nathaniel was an exceedingly handsome young man. I don't remember meeting him in person, but the pictures, he's just an incredibly handsome young man. That's commonly the case. They spend a lot of time looking into mirrors at real or imagined flaws. There can be a little blemish, and to them it's like the whole world can see this. The first patient I saw about 35 years ago with BDD was one of my psychotherapy patients, and she started to develop this preoccupation with a vein in her leg. So she couldn't go to the beach and put on her swimming suit because everybody there would be looking at this vein, and all it was a normal vein that you could see through her skin, and this preoccupied her whole life. And then eventually she felt that her nose was malformed, and she came in and she would only talk to me like this. And then she wouldn't even come to appointments. She quit school and just went, would only go out at night in strange routes. And I didn't know what it was at the time. I called, I think I was a first or second year psychiatric resident at Mass General. I called one of my mentors, Ned Kassem. He immediately knew what it was. That was the thing about Ned. He knew everything. So he said, oh, that's called dysmorphophobia. And over the years, this has now become called BDD. So they often cover up the affected areas, hats, scarves, hands, makeup, Band-Aids, constantly seeking reassurance that other people tell them that they're okay. The reassurance never lasts long. Frequent unnecessary appointments with medical professionals, repeated unnecessary plastic surgery, compulsive skin picking, often use nails and tweezers to remove blemishes and hair. They avoid social situations, as my patient did, don't want to go into public places, quit work, quit school, kind of drop out of life. Most of them have feelings of disgust. Many, more than half, become depressed. Anxiety, shame, low self-esteem are exceedingly common. BDD is an excruciating, I'm glad I got that word out, I was worried about that, painful disorder. The patients with BDD suffer at just incredible levels of distress. Although there are no careful studies, it is estimated that at least 1% of individuals in the world have BDD. It is often misdiagnosed or not recognized at all. Treatments can be very effective, but sometimes are only of little help, unfortunately. So future research and funding is crucial to save lives. For more information or to contribute to the cause of BDD and OCD research, you can go to the OC Foundation website. If you just look OC Foundation in Boston, it'll come up, but it's www.ocfoundation.org. There are also very good books on BDD and OCD available on Amazon.com. Dr. Sabina Wilhelm, raise your hand. It's right there. Has written one of the finest books that's up to date on BDD, and is doing a lot of research and really a pioneer in this area. Actually, she should be giving this talk, not me. What do I know? But David paid me a lot of money to do this. I want to mention that MGH, the OCD and BDD clinics, you can get free treatment there's more to this sentence, obviously. If you fit into some of the research trials, they're trying to get people into trials so that we can learn more about OCD, and there's no charge for people that will do the trials. Now, my next task is to welcome Dennis, who I just met a couple of hours ago. Met him and his wife and daughter. Last May, after the death of their son and brother Nathaniel, the Aslan family, Dennis, Judy, and daughter Carrie, flew to Spain to walk the Camino de Santiago, the ancient pilgrimage route, to reflect on Nathaniel's life and walk in his memory. Upon returning from their trip, Dennis caught Camino fever, as he puts it, and developed the irresistible urge to walk. This is what it looks like when a man has an irresistible urge to walk. It's not a pretty sight, I'm sorry. Just kidding, just kidding. It was during one of his many long walks. Why don't I just stick to the script in these things? He developed the plan to Walking with Nathaniel 2012 project, and this is the culmination of it right now. On April 24, 2012, 45 days ago, Dennis began his walk from Cheney, Pennsylvania to Boston, Mass. The 525-mile route included stops at hospitals, clinics, doctors' offices, and treatment facilities that were part of Nathaniel's journey, including McLean Hospital OCD Institute and MGH BDD Clinic here in Boston. Other stops included places of joy, such as the Bryn Mawr Birth Center, Goshen Friends School, the Shipley School, Westtown School, where Nathaniel was a student, teacher, and coach, and the Good Fellowship Ambulance and EMS unit, where he often volunteered. Dennis. Don't give anything. No, sorry. Through your very personal and yet public pilgrimage, you have put Nathaniel's face and story on OCD and BDD. Because of your determination, courage, and willingness to share your family's story, you are an inspiration to those of us who have joined you here today and accompany you on this journey of the Spirit, and some in person. We are confident that your pilgrimage in memory of Nathaniel has helped many others along the way. Ladies and gentlemen, Dennis. I finally get to